Since the declaration of COVID-19 as a pandemic by the World Health Organization in March 2020, many suffered due to this emerging infectious disease that caused major economic, social, and environmental impacts. In Asia and the Pacific, the high transmission rate of the COVID-19 virus put pressure on countries' health systems after nearly 2 years into the pandemic.
Yung mga PPEs kasi noon talagang nagkulang kami sa PPEs. Talagang lahat naman tayo, even the mask, no? Yung mga surgical mask talagang kulang.
Nung pandemic, sobrang dumami ang aming waste. Kasi unexpected yung pangyayari eh.
Nung nag-COVID pandemic, yun talaga yung naging #1 problem namin. Kasi sobrang dami ng waste, maabot na sa times na nasa labas na ng storage. Punong-puno, ang dami ng generation ng waste.
Time po ng pandemic, mataas po talaga yung volume ng infectious waste namin, pati yung hindi po pwedeng galawin yung black tsaka green. Automatic po talaga, sa yellow po talaga siya.
Underdeveloped countries hit capacity limits earlier than those in developed nations. Health infrastructure is often severely lacking, struggling to provide even basic healthcare services in normal times.
Nung nagkaroon ng pandemic, nag-increase siya in 2-fold, 3-folds, gano'n. Dahil nga may mga bagay na kailangan ng i-dispose ka agad.
From 300 kilos a day, nung pandemic, talagang mararamdaman mo yung pagtaas. Kasi almost nasa 500 kilos a day kami.
During COVID-19, we had seen a tremendous increase also on this waste generated by the hospital.
As the Philippines begins its journey towards recovery from the economic, social, and environmental impacts caused by the COVID-19 pandemic, issues on public health still remain. The issue of medical waste remains to be one of the most critical challenges towards health systems in many developing countries.
Pagsubok po namin na kinakaharap lalo na pandemic po, yung storage po namin, napakaliit po talaga. Wala po kaming magandang facility na pwedeng paglagay ng basura.
Dahil nga dito sa pandemic, nagbuo agad ng team City Solid Waste Management Office para lang task to manage the infectious waste generated during the time ng pandemic.
The management of waste disposal was through a private service provider, no? So we pay the service provider to collect the infectious waste. They'll place it in a sealed truck and then brought to a site where the infectious solid materials will be disposed.
In April 2020, the Asian Development Bank has estimated that in Metro Manila, around 280 tons per day of additional medical wastes will be generated, or 16,800 tons for 60 days. More than 2 years later, the Department of Environment and Natural Resources reported that it collects 1,000 tons of medical waste every day, or equivalent to 166 trucks. China's Global Development and South-South Cooperation Fund, operated by China International Development Cooperation Agency, has funded the COVID-19 Healthcare Waste Management Response Project in the Philippines. This project aims to share China's successful experiences and establish regional connectivity within and beyond the project partner countries for sustainable cooperation on COVID-19 response and related efforts. To be led by the United Nations Development Program Philippines in partnership with the Department of Health, the UNDP-GDF COVID-19 Healthcare Waste Management Response Project will help strengthen the preparedness and responding capacity of the Philippines at the regional level. Through the generous support of GDF and SIDCA, 2 waste autoclaves have been turned over to Pasig City General Hospital in Pasig City and to Dr. Jose N. Rodriguez Memorial Hospital and Sanitarium in Caloocan City, also providing additional medical and waste management supplies needed. UNDP, DOH, in partnership with Healthcare Without Harm, also conducted training sessions on waste management, waste audit, and digital waste registry to prepare and capacitate the healthcare workforce of participating hospitals.
Mapapagaan po yung trabaho rin po namin. Kasi po, less na po yung mailalagay namin sa storage. Tapos yung volume nga po ng basura.
It can strengthen or furthermore develop the practices or compliance of the people here in terms of disposal of waste. By then, we are ensuring that the safety of the patients and at the same time the safety of the employees and healthcare workers are also being protected. So with this we are also ensuring that even those who are coming in the hospital are safe, especially those community people who are living nearby.
We'll be saving a lot of money since we will not be hiring the services of a private service provider for the collection of the solid infectious waste.
Nami-minimize yung volume ng waste created sa isang healthcare institution.
The UNDP-GDF COVID-19 Healthcare Waste Management Response Project fully commits to supporting the Philippine government in combating the COVID-19 pandemic and its continuing impacts to public and environmental health.
Makakatulong to sa achievement ng Sustainable Development Goals ng UN. No? Malaking bagay iyon dahil yung pagpasok ng mga ganitong technology is one step, no, further to improve the system.
So this is such a great blessing for us at the time that it was really needed. So it was during the pandemic, and until now it is an ongoing need of the hospital. And this project would mean also that focusing on leveling up the infectious waste management of our hospital would also mean leveling up the standard quality of the service that we provide to our patients.
Maraming salamat kasi isa kami sa nabigyan ng pagkakataon na ma-improve yung healthcare waste management ng hospital.